Viral hepatitis. Today, we are diving into an extremely important topic that affects millions worldwide, the viral hepatitis. So, let's get started. What is viral hepatitis? Hepatitis is the inflammation of liver. So, viral hepatitis is a liver inflammation caused by viral infection. It can potentially lead to acute or chronic hepatitis. While most acute cases of hepatitis resolve without treatment, chronic hepatitis can lead to serious complications like liver damage, scarring of liver, cirrhosis, and even liver cancer. How to know if hepatitis is acute or chronic? Hepatitis can be either acute or chronic. It is primarily distinguished by the duration of liver inflammation. Acute hepatitis is a short-term condition, lasting less than 6 months, while chronic hepatitis persists for longer than 6 months. What is the main cause of viral hepatitis? It is caused by various viruses, mainly hepatitis A, B, C, D, and E. Types of viral hepatitis. Hepatitis A. It typically causes a mild, self-limiting acute infection. Hepatitis B can be acute or chronic. Hepatitis C can be acute or chronic. Hepatitis D can only infect individuals already infected with hepatitis B. It can cause both co-infection and superinfection with hepatitis B, hepatitis E. It is typically a self-limiting acute infection, but can significantly increase the risk of mortality if the patient is pregnant. It can also become chronic hepatitis if the patient is immunocompromised. How is viral hepatitis transmitted? Transmission. Hepatitis A, HAV, is primarily spread through fecal-oral route, by contaminated food or water. Hepatitis B, HBV, spreads through contact with bodily fluids, like blood, semen, and other fluids. This can also be transmitted from a mother to the baby during childbirth. Hepatitis C, HCV, primarily spreads through contact with contaminated blood, most commonly through sharing needles and syringes for intravenous drug use. Hepatitis D, HDV, only occurs in individuals already infected with hepatitis B. It is transmitted through the same routes as hepatitis B. Hepatitis E, HEV, primarily spreads through fecal-oral route, by contaminated food or water, and it can also be transmitted by consuming undercooked meat or wildlife. Symptoms of viral hepatitis. Acute hepatitis lasts less than 6 months, while chronic hepatitis persists longer. Acute hepatitis usually resolves, while chronic hepatitis can lead to more severe complications. Symptoms presentation. Acute hepatitis. Acute hepatitis often has an onset with flu-like symptoms. It may include fatigue, nausea, loss of appetite, abdominal pain, and jaundice, yellowing of the skin and eyes. Chronic hepatitis. Chronic hepatitis may have no noticeable symptoms for years, making early detection challenging. As the disease progresses, symptoms may include fatigue, abdominal pain, often in the upper right quadrant, and other signs of liver disease like jaundice, ascites, fluid buildup in the abdomen, and spider angiomas, spider-like blood vessels on the skin. Later, chronic hepatitis can lead to liver cirrhosis, scarring of the liver, and liver failure, and in some cases, hepatocellular carcinoma, liver cancer. How long does viral hepatitis last? Viral hepatitis can last from a few weeks to a lifetime, depending on the type of virus and whether the infection becomes chronic. Acute viral hepatitis, like hepatitis A and E, typically resolve within a few weeks or months, with most people recovering within 6 months. These types of hepatitis do not become chronic and generally do not cause long-term health problems. If hepatitis B and C are also acting acutely, it will last up to maximum 6 months, with most adults clearing the virus. However, hepatitis B and C can become chronic if hepatitis B and C virus persists for longer than 6 months. It becomes chronic, and the virus can stay in the body for life, thus leading to potential long-term complications. Is hepatitis 100% curable? No. Not all types of hepatitis are 100% curable. While hepatitis A and C are curable, Hepatitis B and D are chronic diseases that may be managed, but not cured. Hepatitis A typically clears up on its own, without requiring medication. Hepatitis C can be cured with direct-acting antiviral medications. Hepatitis B. Acute hepatitis B often clears up on its own. But chronic hepatitis B is a lifelong disease that can be managed with medication to prevent complications, but there's no cure. Hepatitis D can only occur with hepatitis B, and it increases the risk of liver damage and complications. Hepatitis E typically clears up on its own, without requiring medication. However, chronic hepatitis E, which can occur in immunocompromised individuals, may require medication. How can you prevent viral hepatitis? Viral hepatitis can be prevented by following steps. Vaccination. Safe and effective vaccines are available for hepatitis A, HAV, hepatitis B, HBV, and hepatitis E, HEV. The World Health Organization, WHO, recommends vaccination, especially for HBV, as a primary tool for prevention. Safe sex practices. Safer sex practices, including using condoms and minimizing the number of sexual partners, are crucial in preventing the spread of hepatitis. Avoiding shared needles and equipment. Sharing needles or equipment used for drug injection, tattoos, or piercings can transmit hepatitis viruses. Safe food and water. Proper sanitation, safe drinking water, and safe food preparation practices are essential to prevent hepatitis A and E infections. Other prevention measures. Additional strategies include screening. The blood used for transfusion helps to prevent hepatitis B and C. In conclusion, viral hepatitis is a serious global health issue, but with proper knowledge, prevention strategies, and timely treatment, we can effectively control and combat its impact. Thank you for your attention, and let's stay committed to spreading awareness and promoting good health practices. Stay safe and take care.